Now we will discuss about vitamin B6. Vitamin B6, also called as pyridoxine. Function: it is vitamin B6 is converted to pyridoxal phosphate or PLP. PLP is pyridoxal phosphate. Its normal name is pyridoxine or vitamin B6. It is converted to pyridoxal phosphate or PLP. It is a cofactor. Cofactor is it helps, or it is a helper used in transamination. For example, ALT and AST. It is used in transamination in ALT, alanine aminotransferase and aspartate transferase AST, and decarboxylation reactions, glycogen phosphorylase, and it also help in synthesis of glutathione, cystathionine, heme, niacin, histamine, and neurotransmitters including serotonin, epinephrine and norepinephrine or NE, dopamine and GABA. Deficiency of vitamin B6 or pyridoxine, it causes convulsions, hyperirritability, peripheral neuropathy, deficiency inducible by isoniazid and oral contraceptives, sideroblastic anemia due to impaired hemoglobin synthesis and iron excess. So due to its deficiency, it causes convulsions, hyperirritability, peripheral neuropathy, and sideroblastic anemia. Vitamin B7. Vitamin B7, it is also called biotin. Biotin or vitamin B7. It is present in the hairs and nails. Function: it is a cofactor or helper for carboxylation enzyme which add one carbon group. One is pyruvate carboxylase, Acetyl-CoA carboxylase, Propionyl-CoA carboxylase. Pyruvate carboxylase, it is used in gluconeogenesis. Pyruvate 3 carbon, it is converted to oxaloacetate 4 carbon. Acetyl-CoA carboxylase fatty acid synthesis, Acetyl-CoA 2 carbon, it is converted to malonyl-CoA 3 carbon. Propionyl-CoA carboxylase fatty acid oxidation and branched chain amino acid breakdown. Propionyl-CoA 3 carbon is converted to methyl malonyl-CoA 4 carbon. Deficiency of vitamin B7, it causes relatively rare dermatitis, arthritis, alopecia. So it causes dermatitis or inflammation of skin, arthritis and alopecia, losing of hairs or thinning of hairs. It is caused by long-term antibiotic use or excessive ingestion of raw egg whites. When for long term we use antibiotics or egg white, so it causes deficiency of vitamin B7. So avidin in egg whites avidly binds biotin. So that's why it leads to deficiency of vitamin B7 or biotin. Vitamin B9. Vitamin B9, it is also called folate. Other name of vitamin B9 is folate. It is converted to tetrahydrofolic acid or THF. Folate is converted to tetrahydrofolic acid, THF, a coenzyme for one carbon transfer methylation reactions. It is important for synthesis of nitrogenous bases in DNA and RNA. So nitrogenous bases in DNA and RNA are synthesized with the help of vitamin B9. Vitamin B9 folate is found in leafy green vegetables, also produced by gut microbiota. Folate observed in jejunum jungles. Small reserve pool stored primarily in the liver. Small pool of the vitamin B9 9 it is stored in the liver. Deficiency of vitamin B9 or folate, it causes macrocytic or megaloblastic anemia. Macrocytic, it meaning is very large cell size that leads to megaloblastic anemia, very large sized red blood cell, and hypersegmented polymorphonuclear cells or PMNs. Glossitis. Glossitis is inflammation or redness of the tongue, non-neurological symptom as opposed to vitamin B12 deficiency. So, vitamin B9 folate deficiency does not cause any neurologic symptoms, but vitamin B12 deficiency, it causes neurologic symptoms. Labs shows increased homocysteine, normal methylmalonic acid levels seen in chronic alcohol overuse and in pregnancy. Vitamin B9 deficiency can be caused by several drugs. For example, phenytoin. This drug is used in epilepsy. Trimethoprim, it is antibiotic, and methotrexate, it is used in like joint problems, or methotrexate is used. Supplemental folic acid at least 1 month prior to conception. Folic acid is used 1 month prior to the conception or during the pregnancy, because it to decrease risk of neural tube defect in the baby in the womb. Give vitamin B9 for the 9 months of pregnancy and 1 month prior to conception. Why? Because it is very useful to decrease risk of neural tube defect in the baby during the pregnancy. So we have discussed vitamin B9.